Hi, I am sitting here at Malvern's first community health center, and I have the privilege to be sitting here with the executive director of this wonderful project that's underway, Mr. Liben Gebremikael. How did that name come to be, and what does that mean?
TAIBU is an East African a word from the Swahili language, which is a greeting or a wish to say, be in good health. And initially, when the Black Health Alliance was conceptualizing this great initiative, they thought that the main priority of this community health center is to ensure that community members and the community as a whole is in good health.
What is a community health center?
So community health centers are, first of all, non-profit organizations. They are community-governed organizations, so board of directors are from the community. Could be clients, could be residents in Malvern, or people who work in Malvern or who have interest in the community. It's also a primary health care with interdisciplinary professionals providing care. So we have physicians, family physicians, we have nurse practitioners, registered nurses, chiropodists who provide food care, dietitian, social worker, health promoters, and community health workers. TAIBU Community Health Center was initially, the idea and the concept came from the sponsoring organization, which was the Black Health Alliance. And they did quite a lot of work in lobbying with the government and engaging the government in discussions about providing healthcare services, particularly for the Black community. But also not just being exclusive, but also inclusive of other racialized and marginalized communities. So Malvern being one of the priority neighborhoods, and number two, also Scarborough, as you know, and also Malvern has a high number of immigrant communities, and so it was thought that this would be a good place to have community health centers such as TAIBU placed in. Major priority populations in Malvern are the South Asian community and the Black community, which is about 20% of the population here in Malvern. So the Black Health Alliance thought that this would be a strategic place to have a community health center. There are also a lot of needs and gaps in Malvern. Yes, there are a lot of service providing agencies, but in terms of the health aspect of the community, there really wasn't something that really could provide the community better support and better service. So,
what are the types of programs or things that are happening now to sort of engage the community and get them in here?
We are working with the seniors, to break some of the social isolation that they experience. So we're doing some social interaction programs, like we have a dinner and movie night in one of the seniors' residence in Malvern here. We provide some gentle exercise for the seniors, like Tai Chi and yoga. We are also engaging with the youth and delivering some programs with the youth. Some are very creative. We just finished a project called Photo Voice, where young members of the community get involved in a photo project where they take pictures of how they see their community, and that would be this promotion activity that we're doing. We're also, doing some advocacy work with some groups in the community and building their capacity. We run a community kitchen in one of the co-ops in Malvern, which has been quite successful, where come together, learn how to cook healthy food for them and their children. We also involve our dietitian to come in and do food demonstration and nutrition education programs. And the parents meet once a week and they cook. And they learn how to cook with limited budget. They cook, and then their children, when their children come back from school, they have their dinner in that community kitchen. So that has been also very successful. So and we're planning more, but these are some of the highlights that we do. And this is in addition to the clinical services that we provide through our physicians who see clients on a regular basis, our nurse practitioner, and we also have now almost a fully booked food care clinic for seniors or people with diabetes or other. We have this mandate of developing specialized programs and services, particularly for the Black community. Although the center is open to all residents of Malvern, we have a specialized focus on delivering programs and services for the Black community. Now, we know that there are a lot of barriers affecting the Black community. There are certain health issues and concerns that specifically affect the Black community or are more prevalent in the Black community than in other communities. So this would give us a good opportunity to address those issues in a focused. The specialized programs may be looking at some chronic diseases that particularly affect the Black community. So we know hypertension is very prevalent in the Black community, diabetes. The Black community is one of the high-risk population for diabetes. So we will be focusing, although we have a program for all chronic diseases, but we'll be focusing and targeting the Black community specifically to address these issues and address the inequalities of access, but also inequalities of outcome for the Black community. Mental health and addiction is another area of concern or identified need of the Black community, so we'll be working with other service providers to be able to deliver those programs. The other area would be, for example, sickle cell disease, which predominantly affects the Black community. So we will be working with other associations, for example, the Sickle Cell Association, who have been doing quite a lot of work out there and supporting them in bringing those services here to be able to serve our community. There are other, when we talk about the Black community, it's quite diverse. So we have the African diaspora who are, under-resourced, and there aren't a lot of, and there's a lot of gap in health information. We don't know the data available around ethnicity is non-existent in Canada. We rely on more research, done or conducted in the US or in the UK. So one of the vision of TAIBU, and the board has established this vision, is that TAIBU become a center of excellence and developing best practices to be used in other settings that serve racialized, marginalized communities. So we will also be involved in doing research and studies around barriers affecting the Black community in particular. I have to say we are very excited about our new permanent home. The building is already up. We have to go through the process with the Ministry of Health regarding our capital project. It's going to be a very spacious place where people can come in and feel, welcomed and comfortable when they are receiving their service. So that's a great excitement. So it is across the mall of the Malvern Town Centre. I believe the address will be 27 Tapscott Road. But, if you live in Malvern or pass by the mall, you can't miss it. It's a nice new building that is being erected. So that's where we will be probably here. Right now we are located at 1371 Nielsen Road. The nearest intersection is Nielsen and McLevin. We are situated, our administration and health promotion offices are on the fourth floor, and our clinic medical services are located on the second floor.